This is Bella. Bella is a bit of a hoarder. She loves collecting shoes, but because she has so many to choose from, things are getting a bit messy, and least to mention expensive. Sometimes when Bella is running late for uni or an interview, she can only find one pair. What if shoes didn't have to be worn in pairs? What if there was a universal shoe? This would reduce the amount of time spent searching for the matching pair, or even saving money when one shoe gets lost or damaged. Well, fertility clinics worldwide use a freezing technique called cryopreservation. There are two types, slow freezing, which is the conventional method, and ultra-rapid freezing or vitrification, which has become the mainstay for cryopreservation. This technology has allowed for several advancements in the field of assisted reproductive technologies. Pioneering researchers have proven time and time again ways to refine and advance the technique. But there's just one catch. Vitrification is kind of like a pair of shoes. Clinics today require the freezing and thawing solutions to match. An egg or embryo that has been frozen with brand X must be thawed out with the same brand X. This kind of raises some issues for us. Making sure kits match is becoming difficult, not only due to commercialization, meaning there are many freezing products clinics could choose to use, but also because it's becoming common for patients to transport their frozen eggs and embryos between clinics. This means fertility centres need to ensure they have the matching kits to thaw the incoming eggs that have been frozen with whatever freezing brand was chosen by the previous clinic. It's complicated, it's inconvenient, it's timely outsourcing kits, and not to mention the expenses that accompany these challenges. Well, my study looked at exploring how effective it would be to not have to match kits, just like not having to match shoes. What if it were possible to unmatch freezing and thawing kits? What if we had one universal warming product that could be paired with any vitrification product? Just like unmatching our shoes, implementing this universal warming protocol would save fertility centres time and money. By employing 8 female mice in which their eggs were removed and developed to the blastocyst stage, we were able to freeze these embryos with one of 3 different vitrification kits. We then thawed them out with either their corresponding warming kit to match the freezing products used, or with a universal warming solution that was made by our scientists in-house. My study found no differences in survival rates of these cells when thawed with the matching or unmatching products. What we found was groundbreaking. Not only was it one of the first studies investigating a universal warming protocol in mouse embryos, but our results reflected those that were found by pioneering researchers Parmigiani and his team. This shows promise and potential for implementing a universal warming protocol into fertility clinics in the future. Next, we would investigate clinical outcomes, such as implantation and clinical pregnancy rates of universally thawed embryos. Researchers could also move from an animal model to a human model to confirm the efficacy of this protocol. So what does this mean for clinics? Instead of letting hoarders hoard, Bella and fertility clinics should start clearing out their shoe closets and stock up on a more convenient and cost-effective universal shoe.